Hi, I'm Brian Grant, and you're listening to On Time, the Brian Grant Foundation podcast about living with Parkinson's. If you want to know more about Brian Grant Foundation, go to briangrant.org.
Hi, this is Katrina Call, Executive Director of the Brian Grant Foundation. Thank you for listening to our podcast, which is one of our many programs to help empower people impacted by Parkinson's disease to lead active and fulfilling lives. Our programs are possible because of the generous support of our donors. Please consider helping us continue this work by making a donation at briangrant.org. Thanks again for listening.
Hello, and welcome to the Brian Grant Foundation podcast On Time. I'm your host, Larry Gifford. Today, we're diving into a subject that affects many people, yet doesn't always get the attention it deserves: the connection between toxic chemicals and Parkinson's disease. This is part one of a four-part series where we'll be exploring the environmental factors that may contribute to the onset of Parkinson's. My guest today is Dr. Ray Dorsey, a neurologist at the University of Rochester Medical Center and a leading voice in the fight to end Parkinson's disease. Dr. Dorsey is the co-author of the book Ending Parkinson's Disease and is here to help us better understand the role of toxic chemicals in triggering Parkinson's. Welcome to the show, Dr. Dorsey.
Outstanding to be with you, Larry. Huge fan of you, huge fan of PD Avengers, Brian Grant, and the Brian Grant Foundation. The only thing I would say at the beginning is this doesn't affect many people. I think it affects almost everyone with Parkinson's disease. I think has it due to environmental factors in our food, water, and air.
So most people.
I think almost every person,
Every person.
Almost only what percent of Parkinson's is purely due to genetic causes? Do you know that?
Like 9%?
1%.
Really?
So LRRK2, the most common genetic cause of Parkinson's disease, affects how many people?
I don't know.
2 to 3%.
Okay.
And your lifetime risk of developing disease, if you carry LRRK2, the most common genetic cause, is 40%. That means most people carrying a LRRK2 mutation will never develop Parkinson's disease. Also means that there have to be other factors, genetic or environmental or otherwise, that are explaining why even the 15% of people who carry a genetic risk or genetic risk factor develop the disease. 85% of people, including you, Larry, I think, do not carry a genetic risk or genetic risk factor for Parkinson's disease. 85% of people, including you, Larry, do not have a family history of the disease. We've known this for over 100 years. We've known for 25 years from Carly Tanner. I think she's speaking on your subsequent interviews. She showed in a twin study 25 years ago, published in JAMA, cited hundreds of times, that for the vast majority of people with Parkinson's disease, that environmental factors are the predominant cause, and that genetic factors are only likely a major contributor for people with young onset Parkinson's. And even for that, I think, like you, it's environmental factors.
That's a whole lot of information coming to us all at once. We're going to break it down a little bit here, slow down, tear it apart, zoom back up to 30,000 feet a little bit. Let's start out by explaining how we've come to understand the relationship between toxic chemicals and Parkinson's.
So the first major clue was research done by Dr. Bill Langston, neurologist, Santa Clara Valley Hospital, 1987, plus or minus, minding his own business as a neurologist on service. And the residents come up to him and said, Dr. Langston, we have patients in the emergency room. They look like they have Parkinson's disease, but two things. One, it came on all of a sudden. It didn't just come in over years. And two, they're young. They're like in their 30s. And he goes, well, that's odd. So he plops his way down to the emergency room and starts seeing these patients. And sure enough, they're young and they look like they have Parkinson's. And it came on all of a sudden. Through a lot of detective work, he finds out that all these individuals had been using a street form of heroin. And the production of that street form of heroin, they had inadvertently produced a chemical called MPTP, which kills the dopamine-producing nerve cells that are lost in Parkinson's disease. So these people were using a street form of heroin. Incidentally, in making their own designer drug, inadvertently created a chemical that happened to kill off these dopamine-producing nerve cells. They were likely inhaling this chemical. I don't know how they were observing it. They were getting exposed to this chemical. Turns out that chemical has a chemical structure that's nearly identical to that of a pesticide, to a weed killer called paraquat.
Well,
So MPTP, that identified in 1970 as the first environmental cause of Parkinson's, has a chemical structure that's nearly identical to a weed killer that's sprayed on fields in Ohio, in New York, in Chicago, or Illinois, all throughout this country. 50 countries, including China, have banned it. Dr. Tanner showed that's associated with a 150% increased risk of Parkinson's disease, and it's still being used in the United States.
Okay, so we've got paraquat. What are some of the other specific chemicals that have been linked to Parkinson's?
So the one that's most relevant for your audience is trichloroethylene. So Brian Grant was a 3-year-old boy, and his father was a Marine, and he was based at Camp Lejeune, where lots of Marines were based, especially for training. And he happened to be based at Camp Lejeune when it was contaminated with a chemical called trichloroethylene. Now, trichloroethylene is what I think might be the most important cause of Parkinson's disease in the United States. Now, I think that most of my colleagues don't, but I do. It's a very simple chemical. Everyone knows that water is made of 3 atoms, H2O. Trichloroethylene is made up of a whopping 6 atoms, 2 carbons in black, 1 hydrogen white, and 3 chlorines in blue, hence its name, trichloroethylene. It's got a closely related cousin called perchloroethylene that has 1 additional hydrogen instead of 1 additional chlorine atom instead of the hydrogen. Turned out that the water at Camp Lejeune, which is a big Marine base, think Ohio State University, think like a huge campus, was contaminated with this chemical from a dry cleaner on the base. The Marine officers needed to have spotless uniforms, so they went to a dry cleaner, which inappropriately disposed of the chemical and contaminated the water, also contained from other sources. And for 25 years, from 1953 to 1987, an estimated 1 million Marines, their family members, and civilians were exposed to toxic levels of this chemical in their drinking water, and were likely exposed to it through inhalation because this chemical readily evaporates. So you're taking a hot shower, this chemical is being evaporated. So you're not only getting it on your skin, you're inhaling it as well. And it's a recent study done by Dr. Caroline Tanner and Sam Goldman showed that Marines who served at Camp Lejeune had a 70% increased risk of developing Parkinson's compared to Marines who served at Camp Pendleton. Turns out Marines by definition are healthy, right?
Yeah.
By definition, young. So on average age, they were 20. And they were only there 2 years, 25 months on average. Yet 35 years later, you don't get exposed one day, you don't smoke a cigarette and get lung cancer the next day. 35 years later, they had a 70% increased risk of Parkinson. Now, why does this affect the Brian Grant Foundation? Well, because Brian Grant was a 3-year-old boy. And TCE, this chemical is known to cause cancer. Everyone agrees that. World Health Organization says it causes cancer. Department of Health and Human Services says it causes cancer. EPA says it causes cancer. His father dies of esophageal cancer later in his life. His younger brother nearly dies from a respiratory illness likely related to this chemical. Miraculously got better when the family left Camp Lejeune. And then 35 years later, while still playing in the NBA, Brian Grant develops a tremor in his left hand, can't jump off his left leg like he once could. And I think about 2 years after he finished playing in the NBA, he was diagnosed with Parkinson's disease. So you have the Brian Grant Foundation, its principal, being a 3-year-old boy at Camp Lejeune, exposed to a chemical that's linked to a 70% increased risk of Parkinson's disease, and he's developing the disease in exactly the time frame that you would expect.
The TCE, paraquat, are there any others?
Yes. And the last one I would say is air pollution. So there's increasing evidence linking air pollution to Parkinson's disease. Dr. Brad Reset at the Barrow Neurological Institute recently showed a map of the United States and showed high degrees of concordance between high rates of particulate matter, little pieces of dirt and soot that you see in the smog in Los Angeles, for example, and high rates of Parkinson's disease. Conversely, he also showed that low rates of particulate matter correlated with low rates of Parkinson's disease. So in your food, it's pesticides, certain pesticides. In your water, it's these dry cleaning chemicals, which can also evaporate and pollute your indoor air. And then your outdoor air, it's outdoor air pollution like from cars and the like.
It's got us surrounded, Ray. What do we do?
So we clean up our food, water, and air, and we say goodbye to Parkinson's disease.
Okay. How prevalent are these chemicals and particles in our environment?
They're everywhere, unfortunately. So, pesticides, Beata Ritz from UCLA showed that you don't necessarily even need to be a farmer. You don't need to work with these chemicals. Simply living or working near where these chemicals are sprayed doubles your risk of Parkinson's disease. Trichloroethylene contaminates up to 30% of groundwater in the United States. Over half of Superfund sites, the most toxic sites in the United States, are contaminated with the chemical. We've mapped out over 100 sites contaminated with trichloroethylene or perchloroethylene or both in just Rochester, New York, just 100 sites alone. In Washington State, Elmer Diaz from the State Department of Health has identified 80 childcare centers that are located within 300 feet. 80 childcare centers in the state of Washington located within 300 feet of a current or former dry cleaner, putting them at risk for indoor air pollution. This chemical evaporates. Most people know that radon evaporates from the soil, can enter your basement and cause lung cancer. This chemical, trichloroethylene, can evaporate from groundwater or soil and enter your kid's school, daycare center, your home, or your workplace, and increase your risk of Parkinson's disease. Air pollution has gotten better. So air pollution, 50 to 90% improvement. Anyone who was in LA in the 1950s or 60s knows that air quality in LA is vastly improved than where it once was. If we continue to improve air quality, we're going to get fewer people getting Alzheimer's disease, and we're going to contribute to less Parkinson's.
Now, TCE has an interesting background. What was it originally made for, and what are some of the different things it's done over the years?
So this chemical, if you can believe it, I still have a hard time believing it was created in 1864. So 1864 is when Abraham Lincoln was president. It's been used since the 1920s. It's been initially used to dry clean clothes. So the reason we dry clean clothes, you know why we dry clean clothes? Do you know why we dry clean clothes?
I don't know why.
The reason we dry clean clothes is so our clothes don't shrink.
Okay.
That's why we dry clean clothes. So we are exposing ourselves to chemicals that we know cause cancer just so our clothes don't shrink.
Clothes are expensive, but it's not worth that.
It's not worth that. So it used to be that kerosene and petroleum products were used to dry clean clothes, but the unfortunate property of being flammable. So trichloroethylene came along because it's non-flammable. And then it was used to dry clean clothes in the 1950s until its cousin, perchloroethylene, with the one more chlorine atom, replaced it. It was also used to decaffeinate coffee. So if you drank Senka in the 1970s, you were likely being exposed to this. It's volatile, so it was used as an anesthetic agent. If you were in child labor in the United States in 50s, 60s, and 70s, you may have been exposed to this, which an article in one of the obstetrics and gynecology journals said that, I think Dr. Flower said that every obstetrician would find a useful place for it in his practice until the FDA banned it in 1977. It's used to degrease metal, and that's probably its most common use. So it's that. It's estimated 10 million Americans worked with it: printers, painters, embalmers, mechanics, electronics. The list is long.
It was used in whiteout, right?
It was used in whiteout, in typewriter correction fluid, and the like.
Wow. It's had quite a storied history.
It's everywhere. So like when we pay a lot of attention to forever chemicals, I always think that this is like far worse than forever chemicals. I think it's perhaps even more commonly exposed to it. And you could be living near one of these contaminated dry cleaning sites, for example, and just have no idea. There are kids, I think, in Newport Beach, California, who are breathing in this chemical in their playrooms in Newport Beach, California, multi-million-dollar homes right now.
In your research and work, how significant is the role of TCE in increasing Parkinson's risk?
So the twin study done by Dr. Tanner and Dr. Sam Goldman is looking at World War II twins, and they looked at twins who had either had hobby or occupational exposure to this chemical compared to those who didn't. Those who did had a 500% increased risk of developing Parkinson's disease compared to those who didn't. Brianna D. Miranda, Tim Greenemeyer have done research showing that this chemical increases the activity of LRRK2 protein, the same protein that the LRRK2 gene increases. So the most common genetic cause of Parkinson's disease increases the activity of a protein called LRRK2. This also increases the activity of that same exact protein. This chemical in animal models also leads to loss of dopamine-producing nerve cells, and this chemical in animal models also leads to slowed movement and tremor in laboratory animals.
Now, when you talk about the environment and the pollution and whatnot, that usually comes with the Industrial Revolution. And so is it fair to say that Parkinson's is more prevalent in more advanced societies?
Well, I wouldn't say they're advanced, but in more industrialized societies, higher income nations like the United States and Canada have the highest rates of Parkinson's disease. Areas of the world that are least industrialized, like sub-Saharan Africa, have the lowest rates of Parkinson's, fivefold lower, not like 5% lower, not 10% lower, like 400% lower. And areas of the world undergoing the most rapid industrialization, like China and India, had the fastest increasing rates of Parkinson's disease. Adjusted for age, the prevalence of Parkinson's disease is double in China what it was just a generation ago.
Wow. You wrote the book, Ending Parkinson's Disease, with 3 of your buddies. What have you learned since the book came out in 2021 that has surprised you most in your research regarding environmental triggers?
So in the book, we argued that Parkinson's is likely a man-made disease. I have only grown increasingly convinced of that notion. My fellow co-authors were more skeptical of that notion. I think they've come around too. And I've only grown more and more concerned that trichloroethylene might be the number one cause of Parkinson's disease in the United States. And I didn't even know it existed until about 6 or 7 years ago when Dr. Tanner pointed it out to me. But the more I investigate, the more I read, the more I look, the more I talk to people like you, and your own story, the more concerned I get about this chemical playing a role in the disease.
Now, we were talking a little bit about how different countries are affected by this, or regions, and how are they handling the regulation of the chemicals?
So different. So Europe largely banned most uses of trichloroethylene. Europe's had better air quality like the United States over the last 30 to 40 years. And Europe has stricter regulations on many of the pesticides, not all. Boss Bloom will tell you lots of problems still. But it appears that if you look at the Global Burden of Disease study, Parkinson's disease rates may be plateauing or even decreasing in some Western European nations. Other parts of the world, like Argentina, the 3 countries that permitted paraquat use until at least 2020, Canada, United States, and Argentina were the 3 countries that had the highest rates of Parkinson's disease.
And now paraquat is banned in Canada, so that's good.
Voluntarily withdrawn is my understanding. Yeah.
Yes, so that's good. How do you talk to somebody who's living in a community near industrial areas or near some of these sites that or with TCE? How do you explain to them what's going on, and what's your advice to them?
But I think we're working on a follow-up to our book called The Parkinson's Plan. As part of the Parkinson's plan, there's the Parkinson's Prevention Pyramid. So what are things individuals can do? What are things people can do at the community level? And then what do we need to ask our representatives to do at the state, province, or national level? So I think there are tons of things that we can do at the individual level in terms of buying organic, washing our fruits and vegetables, putting water filter on our water if we live in a heavy area with high degrees of air pollution, to use an air purifier, avoid dry cleaning, especially avoid dry cleaning with perchloroethylene. So I think there's at least 25 things we can do as individuals to lower our risk of Parkinson's. And for people who have the disease, I think it's likely that these things will slow, or certainly could slow, the rate of Parkinson's. For example, if someone's smoking and they develop lung cancer, what's the first thing that a doctor's going to tell them to do?
Stop smoking.
Stop smoking. If you're a farmer and you get Parkinson's disease, what should be the first thing that you should stop doing?
Stop using paraquat.
Stop using paraquat. But we don't tell people that right now. So I think there are things that we can do at the individual level. At your community level, these things are sprayed on your kids. Certain pesticides are sprayed on your kids' playgrounds, schoolyards, sports fields, and the like. In California, they had a law to ban most use of pesticides on schools and required parental notification of any toxic pesticides that were going to be used on a kid's school. I think those are things that we can do in our own community. We can ask our favorite golf course, what chemicals are they spraying on their lawn? If you live near a golf course, I would be asking those questions. And then at state or national level, we need to ban these chemicals. But if you live near a site, you can get your indoor air tested, just like you get your indoor air tested for radon. You can get your indoor air tested for TC or PC. Canada has lots of people getting water from wells. I would have my well tested for pesticides and for trichloroethylene and perchloroethylene. Regardless, I put a carbon filter. I get my water from city water, which in theory is being tested well. I still put a carbon filter like Pure or Brita on my faucet so that I decrease my exposure to this.
I do that too. We just got a new Brita filter. It's great. Love it.
Fantastic.
Looking forward, what changes do you believe are necessary in public health policy to reduce the environmental risks that contribute to Parkinson's?
Listen, we, out of Rachel Carson in 1962, wrote the landmark book Silent Spring, and she didn't argue against the use of pesticides. She argued against the indiscriminate use of pesticides. She pointed out DDT saved thousands, if not millions, of people from getting malaria in World War II. And if you're going to use a chemical to kill mosquitoes so people don't get malaria, sounds like a good trade-off. But indiscriminate use of the DDT after World War II, use increased between 40 and 80-fold. It was literally sprayed. You can get pictures of trucks spraying the pest DDT on kids on the beaches in like Atlantic City. So we can stop indiscriminate use of pesticides. We can decrease our use of pesticides. Pesticide use globally in the United States has only been going up. It's time for it to start going down. It's time to us find safer alternatives. I said that this chemical is from the 1920s. Anyone driving a Model T Ford? Paraquats from the 1950s. Anyone giving their 16-year-old kid a 1950s car?
Nope.
No. We expect engineers to come up with safer airplanes and safer cars. We should expect chemists to come up with safer chemicals that are used to kill unneeded pests.
How is this argument being accepted by our policymakers?
You know, in the United States, we had the National Bill to End Parkinson's Act, which passed the United States House of Representatives 407-9, unanimously passed the Senate. It requires the federal government for the first time to develop a plan to prevent and end the disease. Hat tip to the Michael J. Fox Foundation for their great efforts, and Ted Thompson for doing that. No money's tied to it, but it's a step in the right direction. EPA's proposed, our United States Environmental Protection has proposed banning TCE and PCE. You know, maybe Brian Grant can be the last generation. You and Brian Grant and others can be the last generation of people to get Parkinson's disease from this chemical. If we can't undo the damage that's been done to you, although I'm not so sure, but if we can't undo it, we should at least prevent it for your children and Brian's children and the like from them getting this disease. Paraquat's still allowed in the United States. I don't have a good reason why.
Yeah, it is kind of curious why paraquat remains, I think 8 million pounds of it a year.
I think it's 15 million pounds.
Is it 15 million pounds now?
And it's doubled. And for the last 5 years, for which records are available, use of paraquat has not only still being permitted in the United States, it's being used in increasing amounts. It's considered one of the most toxic weed killers ever created. It kills the weeds that Roundup doesn't. It's been used to commit homicide and suicide. The EPA's own website says 1 sip can kill, yet we still use it.
And there's no reason why other than probably lobbyists.
So there's a great article in The Guardian by a great journalist named Carrie Gillum, which highlights that the chemical company itself, the chemical company's own researchers, exposed mice, rats, and rabbits to paraquat, and they developed the clinical features of Parkinson's, including tremor. They did those experiments in the 1960s. So before you and I were born, the company that makes Roundup, makes paraquat, according to The Guardian, knew about its link to Parkinson's disease over 60 years ago and have continued to use it. They had according to the report from The Guardian, a freedom to sell campaign. I think we should have a freedom to know campaign. This information should be made public. And in fact, according to The Guardian, they withheld some of their studies from regulators. They deliberately, according to The Guardian, sought to discredit a woman, a female scientist who showed that paraquat causes Parkinson's in laboratory animals 30 years after their own research did it. We should hold these wrongdoers accountable for their actions.
It's a little bit insane. You got to be living with all this information, like, feeling like a caged animal. Like, listen to me.
Yeah, so I think you need to come with empathy, right? You need to have empathy for Brian Grant. You need to have empathy for Larry Gifford. You need to have empathy for Michael J. Fox, right? He said he got exposure for some kind of chemical. That's what he thinks causes Parkinson's. I think he's right. And then you need to get some anger, right? You need to get fired up like the PD Avengers. And then you need to act, right? And Mothers Against Drunk Driving, they got empathy, they got angry, and they acted. 10,000 fewer people die each year in drunk driving accidents in the United States since MAD was formed in 1980. 10,000 fewer people, 10,000 fewer schools, 10,000 fewer families, 10,000 fewer communities are torn apart because of the actions of MAD. What a wonderful gift and legacy.
Wow, that's great. Is there anything else our listeners can do to help raise awareness about the link between toxic chemicals and Parkinson's? Any websites they can go to, or?
They can email me at info@endingpd.org. They should join the PD Avengers. Second, they should contribute to the PD Avengers and the Brian Grant Foundation, because Brian Grant shared his story. So because he shares his story, we can make this much more real and tangible to people. They can email me at info@endingpd.org. I love to hear their stories. If they haven't purchased a copy of the book, they can do so. All the authors are giving our proceeds to efforts to prevent and end the disease. You can't afford a copy, you can just email me at info@endingpd.org with your postal address, and we'll send you one for free.
Ray Dorsey, it's been a pleasure. Thank you so much.
My pleasure, Larry. Thank you for all that you do. And it's people like Larry and Sonia and Tim who just changed the course of the diseases. Just like Mothers Against Drunk Driving, it wasn't a trauma surgeon who changed the course of drinking and driving. It was a mother who was most directly affected. Same with the March of Dimes, same with HIV. It's when people who are most directly affected, like Brian Grant, with the diseases, when they share their stories, when they engage in advocacy, when they engage in education, we change the course of the diseases. We get fewer people affected with HIV. We get fewer people affected. We have no one almost affected with polio, fewer people dying from drinking and driving accidents. And we're going to get fewer people in the next 10 years. We're going to have a 0% increase in the rise of Parkinson's disease because of people like the PD Avengers and Larry Gifford. And
this conversation is so critical. And I think many people are just beginning to realize the scope of this issue. So to our listeners, this was just the beginning. Stay tuned for part 2, where we'll dive deeper into specific cases of chemical exposure and its connection to Parkinson's. And until next time, be well. Thanks for joining us on time.
The Brian Grant Foundation empowers people impacted by Parkinson's to lead active and fulfilling lives. Help support our efforts at briangrant.org. A special thank you to Raphael Sadiq for providing the music for this podcast. This podcast is produced by Brian Griggs. Learn more at griggsproductions.com.